So welcome to BW Healthcare World. As a part of our series to talk about quality and patient safety, it is imperative to understand what is the role of the patient when it comes to ensuring safety and quality. Let's talk to Mr. Som Mittal, who's been running an institution which is called the Patient for Patient Safety. So welcome to BW Healthcare World, and we'd love to understand your perspective on this.
Always a pleasure to have a chat with you, and amazing work that you're doing. The healthcare is a huge thing. We have one life, and we all say health is most important.
Correct.
But it is that health that we ignore the most. Yes. And we are all concerned about it, worried about it. But I think the amount of errors that happen, errors in medical care happen for two reasons. One is either it happens because of the healthcare provider. So there are errors that happen in medication, prescriptions, diagnosis. And while the healthcare organizations are trying to do their best, error happen because it's human in nature. But there's a lot of work going on, but errors are happening. It's startling. 1 in 10 globally of people who are hospitalized have some kind of medical harm which was avoidable. Okay. 4 out of 10 happen in OPDs. Okay. It's a huge number. 25% some kind of issue happens in surgery. Now this data is all WHO research data, and by the way, this is not India, it's happening in the US as well. Okay. So error is rather large. So one is what happens in the hospitals. Second is in the hospital, what errors we as a patient make, right? So if I don't tell the doctor everything about myself, my symptoms correctly and so on, how will the doctor find out? Just by checking my nerve is not enough, right? He needs to know my history and so on. Correct. Third is the errors that happen by patients at home. If I'm having symptoms which are of a heart attack, but I want to believe it's gastric, or I can't make out, or if having a stroke, I don't know the symptoms of a stroke. Correct. Right? And if I don't know, I just think something is not right and let me lie down, you're losing time. So I think we realize that patients need to become more aware. And I'll tell you, sir, that most of us who are also educated and think we are very aware, we read a lot, we are all making mistakes every day. Absolutely. So we decided that while CAHO as an organization is working and focusing on quality and safety at the hospital end, who's going to work at the patient end? So we have just taken this task of educating patients, caregivers. And the word patient is a wrong patient. There is no one in the world who will never become a patient. Everybody will become a patient. So we are also focusing on people who don't know they are patients yet, right? And if they are cautious, they can prevent harm. If they are cautious, they can prevent harm to their elders in the family, and they can prevent to the rest of the family. So that's really our task.
Absolutely. And sir, can you explain what are patient rights? Because one is knowledge about what can be prevented, but today a patient is not even aware of what is it that they should be getting at the hospital end. So can you speak about patient rights and explain the responsibilities that they are entitled to from the hospital end?
No, I think this is a very pertinent question. Thank you for asking this, because when a patient goes into a hospital, he's distressed. Doesn't go there by choice. Correct. Right? Hasn't financially planned for it. And there is from the birth we have been told, doctor is God. कि उनके भरोसे दे दिया, they'll take care of you. Correct. And in the process, we forget that we have certain rights. We are also going there as a patient, exposing ourselves, sharing our information. We are also paying for it as a customer. Correct. So first right for me is my right is to get safe care. My right is to not be discriminated. Whether I'm poor, this, caste, otherwise you cannot discriminate. Hospitals are meant to give me care irrespective of my demographics. It's my right to ask questions. If you are telling me to do certain things, or I should ask you questions, right? It's my right. It's my right to get a second opinion. You have prescribed a surgery and I'm not so sure. It's a major surgery. I have the right to know what is it going to cost, right? So I have many of these rights that we don't. It's my right to ask for medical records, right? It is my right to ask for a written diagnosis rather than only put RX and put medicines. Right. What are these medicines for, right? So what was your diagnosis? It's my right. Now we are afraid of the doctors, right? Ki bura lagega. He's asking questions. Did you go through Google it out? Yes, I Googled it out. And that's why I'm asking you these questions. Now, if you can't answer it, your assistant should. I can understand you're busy. We are not going to be a menace. Sometimes patients become a menace, and that's where responsibilities come. So while we have rights, we have responsibilities. Our responsibility is, first responsibility is to give full information. Now, if I'm an alcoholic and I don't tell you as a doctor, I have hidden information and you are doing a diagnosis, right, with the limited. If I'm a smoker and he says, do you smoke? I said, no.
You're giving wrong information.
So sharing full information is my responsibility.
Sharing full information and sharing correct information.
Following a prescription is my responsibility. You can't blame the doctor, right? You can take a second opinion. Not going for the tests. We sometimes say, oh, they're just prescribing tests to make money. Okay, ask somebody else. But he prescribed an MRI, you can ask him why. But once he says this is it, the doctor needs to know more, right? Following treatment plans is my responsibility. I cannot be impolite. You heard of some people misbehaving with doctors and nurses and shouting. They're trying to do their best. Now, many times you bring a patient so late and he unfortunately doesn't survive. Correct. Now, you're blaming for negligence, which is property of the has to be protected, right? So I think these are some of the responsibilities that we also need to do. And last of it, we have to pay. Yes. Right? You cannot have a situation where you at the end don't pay your bills or dispute it and make noise there. It's your right to ask them how much will it cost and your right to not get it done there.
Got it. So you have the rights, you have the responsibility. As a patient, you also have a duty.
Yeah. So this is very important for all of us to know now. As per NABH, there is rights to be written, but then it's on a board, it's a tick in the box, right? I think aware patients or would-be patients or caregivers should have respectfully ask for their right.
Yes, yes. And sir, when we talk about patients' rights, patients' responsibilities, and awareness of the patient, how does patients' involvement in the care, because like you said, we treat doctors as gods, and with us having very limited knowledge, we are relying on them. But how does patients' involvement in the process help in building a better healthcare system? How does it build in the culture of safety and culture of good quality in the Indian healthcare system?
So it will take two to make it happen, right? One is, as a patient, I should demand it, right? I have to demand quality, right? There is all these hospitals do have processes, but are they followed? I gave you examples of right. I should be given my medical record, medical stuff without asking for it. It's not their property, right? The law also says that it's my property, right? But I think let's take it in a positive sense, right? Let's map the journey of a patient. I have symptoms. If I'm aware and I notice it, I present it early. If I present, people say, oh, cancer was detected in 4th phase. We miss the golden hour, right? So awareness first is at our level of saying, this is it. Now people say he's hypochondriac, this, that, but it's okay for me if I thought I had a heart attack and I went to a doctor and he says, it's all fine, right? People say, why are you, I think it's okay, don't worry about anyone else. If you feel unwell, please tell somebody please go and see a doctor. So I think that's the first awareness. That then when you visit a doctor, how are you prepared to, did you make a list of the symptoms? Did you make a list of your medications that you're taking, any allergies that you have, any history that you have of previous surgeries, etc., right? And any questions that you have, because the doctor always looks and combines your physical state with symptoms, and that is how the diagnosis is done. If you had other medical records which you had got tested somewhere, some people say, I will not show the previous one. It's wrong, right? So I think doctor has 10 minutes, and if you remember, there's, we can't change the doctor-patient ratio. So the doctor will get only 10 minutes to see you. Now if you are fumbling with papers, not able to answer, he will say, acha chodo, let me check you out. Okay. And then he takes a diagnosis based on a physical check. Right. So safety comes in at that stage. Then is prescription. If I am an aware patient, right, I am going to ask him, what is this medicine for? If I can't read the spelling, we will not say the pharmacist will read it. I am going to say, sir, can you put it in caps? Right? Yes. Because I can't. If it is, the symbols are not clear, 1 BOD, what does that mean? I don't know. So is it once, twice a day, or what is it? So these are all, correct. So we are actually in patient safety telling people these abbreviations should you know. Correct. Right? Many good doctors now put 1X1, so it tells you a graphical way. Right? So I think asking those questions in the prescription is very important. Right. Okay. Now then you go on and on. I bought medicines, but the brand that was written was not available with the pharmacist. He says, sir, I have a different salt. I said, okay, if you have checked, send it, because one medicine has so many brands, right? But did I check it myself? Because he read it something and he gave, there are many, many examples with very well informed people who sent their driver to get a medicine. He brought a different salt. He ate a medicine that worsened his case, and he was in ICU for 16 days. So now when these things happen in surgery, you've heard of cases including Sri Devi's mother, who went for a brain surgery in US, and she got surgery done on the wrong side. So now in the room they do a marking, and as a patient you can say, show me, as a caregiver, right? That look, is it right? So I think we can enforce these things. Nurse is in a hurry, right? It's actually happened to me. I said, you just gave me the medicine, why are you giving it again? Because the second nurse came, and right? So I think aware patient and aware caregiver, both, right, is very important. Correct.
I totally agree with you. I think it is imperative for the patients and the caregivers as well to be aware of the rights, that they have the right to ask for it. And I think that confidence will come only when they are aware that, it is okay to ask and to question. And so another thing that is very, very important to address when we are looking at patient safety and the patient's involvement is the whole healthcare system for many, many years, in fact decades, has been focusing on getting a testimonial from a patient, because it was always about the word of mouth. But and testimonial is usually from a happy patient. But there is no culture of getting a feedback of every patient, So how do you think getting patient feedback is important, how it makes a difference, and if you can share any example of where it has made a difference to the culture?
So, actually it's about, what you've asked is about the letter and the spirit of this, right? All of us look at feedback. I actually never fill up a form on a feedback, but I write separately, right? Because the feedback is forcing me to rate them 1 to 5, 1 to 5, right? They're all looking for good stuff. My analysis of the limited work that I've done in healthcare space, less than 15% of the patients respond. 15%. And as you know, if I had a bad experience, I will bad mouth you, but I'll shift to the other doctor, other hospital, tell my friends don't go there, but I'll never fill up the form. So those 15% are biased. And then we have this net promoter score, which will sound good, right, on a small base. So, but the genuine feedback is when you actually get a call from the hospital saying, you had a surgery, are you feeling okay? Up till now, you are telling me to report if I have a problem. But you were phoning me for, sir, that test was prescribed, you haven't taken it yet, because that's a revenue follow-up.
Correct, correct.
But if I get a call, when they actually come, so there are lots of places, and I won't use a broad brush to healthcare organizations, the spirit of the doctor is very good. कहते हैं ना इसकी nature बड़ी अच्छी है. Is what? Because the doctor makes you comfortable,
Yes.
right? They are interestingly asked, they give you comfort saying, oh, you'll be fine, right? So that's the time, the feedback that anything we can improve. I think taking a verbal feedback is more important than trying to make them write forms, because the form is forcing them to say. And then many times, as you know, we get calls from our car servicing guy, please give me 10, etc. Right? So, you know, out of goodness, and then, you know, people are happy after a maternity delivery, they'll fill up a form because they're going back happy.
Correct.
Right?
So, I think it is.
I didn't complete it. So I think there are many ways that they are trying to do this now. So there is a process called PREMS, right, which is patient reported experience measure. Then there are PROMs, which is patient reported outcomes,
Yes.
right? So once they actually genuinely take that, CAHO and Patient for Patient Safety, we are encouraging setting up of patient advisory councils, which I would like to be representing patients there as a responsible advocate for patients rather than a noisy member.
Correct.
Right? Because, you know, they are afraid of medical legal cases, and I think that's increasing now, the activism is high. So there are good reasons for them to be careful about how they seek their feedback, but I think if they're genuine, they will get genuine feedback.
Since you mentioned about the medical legal cases, so something that comes to my mind is that when you're looking at the reporting of negligence or something which was avoidable error, for even the research purposes or improving the systems for the future, the patient's response is creating a fear in the doctor towards moving towards a legal case. So which is why he does not even report for the right reasons for improvement. How can we bridge that gap, sir?
So I must be fair to them. I think there are NABH accredited hospitals are actually encouraging this. So a lot of hospitals have a very strong process, not of patient reporting it, but nurses, doctors and staff reporting errors and near misses. And also the rule is that you are not penalized to report a mistake that you might have made, right? And these are captured, these are worked on, right? Organizations like CAHO, which are taking all the possible errors and then teaching them. A large number of hospitals have gone through a checklist, you know, just like the pilot, right?
Yes.
Every time he flies, he still has to go through 100 checks.
Yes.
So there as well, the doctor now, the surgeon calls out one by one, right? There's a checklist there. So I think those processes are helping reduce errors, and also reporting of misses and incidents, right, are evaluated. All sentinel events, right, are analyzed as to why did it happen during the hospitalization or post. So I think there is a lot of work happening there, right? But then, you know, we must be mindful that, and there is no statistics in this country on healthcare. It's amazing,
Yes.
right? How many hospitals are there? How many beds are there? Some vague numbers are there. But, you know, most of the time we land up thinking of large hospital chains and tertiary care, which you and I know about. And I think those are more aware hospitals and hence they do it. But that's not where mass populations go. If you go to tier 2, tier 3 cities, there are very good hospitals who are 100, 200 bed. They are run by very professionals, but that's not true for majority.
Got it. Got it. And sir, patients will be careful, patients will participate and be involved in the process only if they are aware of it. What do you think is the role of communication, and what do you think should be done so that people are made aware of their rights, responsibilities and duties?
So, so there are two parts to your question, right? One of the areas which actually causes a lot of harm is miscommunication.
Right.
What did the doctor say? What did I receive? What did he write? What did I read?
Yes.
Right? I am getting discharged. The time when I am getting discharged, a dietitian comes, a nurse comes and tells me, doctor comes and gives me instructions. There are so many instructions that are given to me when I am leaving that I am happy I am leaving. Right? So I am not even absorbing. Plus the caregiver has changed, because now the caregiver is the person who is now waiting to do payments and release me. Correct. But he is not the caregiver at home.
Right.
Right? So I think there are a lot of areas of the miscommunication happening. Now I am wondering, the doctor knew that I am going to get discharged tomorrow. Why can't you tell me in the evening when I am just waiting?
Yes.
Right? I am absorbing everything, I will be listening to you, but everything must happen in that last half an hour. Right? So the process has to change.
So it's more like a tick mark of what needs to happen.
Yeah, so no, I think they mean it, but they don't see it from my perspective. Right. I don't blame them. They have to put themselves in my shoes. Yes. Am I listening? Right? Am I the caregiver? So they have done their job earnestly, right? But then
it's not at the right time.
The other is that all these areas we have a lot of touch. So there are organizations like ours who will attempt to do this, yes. But there's an overload. So we are not into well-being, right? Sleep early, get up early, walk. We don't talk about it, right? We are only talking about being alert to prevent errors, right? Now we have to listen. A large number of us don't listen because we think we know it all till it happens to us. Correct. Right? For example, all of us have elderly at home, right? Majority of the time when you see major health problems come in because they fall, right. And the decline starts. Do we have grab bars? It takes not even, you can order it and get it and fix grab bars. There are rugs, there is no light at night when they are walking. We don't tell them that they should not get up suddenly and walk, they should wait, because if you have taken some drugs, you may run low blood pressure, so sit. So these are the kind of things that we are trying to make them aware. But don't ignore this. All of us are seeing so many reels and so on Instagram, etc. But when it gets to health, they all write to me saying noble cause, but they don't read. Right? So, but they will get there. We are not going to give that up. The other is, in the hospital, there are lots of touch points. Right. At every touch point is an opportunity to educate verbally, visual, paper, right? When I'm getting discharged, every surgery means there was a cut. Wound care, you have a printout, just put it there, right? So, and when I'm sick, I'm very alert, right? I want to read. When I'm sitting in the blood pressure, I read everything on blood pressure. So a patient is very alert and aware and receiving. Caregiver is very careful, right? So never miss these moments of truth, of a connect with the patient or a caregiver in conveying. Right? I think that is stuff. There are good systems. Many of them have patient information system where they develop these things, but it's about execution. Correct. Right? वो कौन देगा? फॉलो अप हो रहा है कि नहीं, सिस्टम तो बन गया। तो हम भी डिमांड कर सकते हैं कि सर वो हमको तो लिख के दीजिए। उन्होंने मुझे बताया कि एक्सरसाइज करनी है, मैं कहा मुझे नहीं समझ में आया, आप मुझे वो चार्ट बना के वो दे दीजिए। देयर वाज अ चार्ट, देयर वाज अ प्रिंटेड चार्ट अवेलेबल, ही कट आउट 2 of them, 8 of them were there, I use that for my, now I can refer it to,
absolutely
right. So to your point, there are various ways of communicating this. In the Indian context, the problem becomes little more, right, because our demographic language is an issue, right, literacy is an issue,
correct,
comprehension may be an issue, right, and you know, if you look at a place like Delhi, people from other cities and towns are coming in, right. So it's a problem, but we have to start somewhere.
So I think it is a solvable problem. So we just have to find out, and you know, it's very important to understand, you know, like you said, it is not just about providing the information, it is about being mindful of when you are providing the information so that it is accepted, understood in the right manner. Second is interpretation of that conversation is extremely important. So we have to be more mindful about how we deliver the information and when we do that. Now, when the patients become very aware, like we were talking that, you know, sometimes they can be not in the right mind, they can be very, very daunting for the doctor, and this kind of creates a fear in the healthcare provider's mind, right? How does the healthcare system, how does the healthcare delivery person, the institution balance between the autonomy that the patient is given or is expected to have versus doing the right thing for them? Like for example, you know, when we go to a hospital and the patient is taken in and he's been recommended a certain treatment, and the patients feel that, you know, sab reports so theek thi, aap kyun kar rahe ho, right, and they take a call ke hame nahi karana, and that could be actually detrimental to the health of the patient. So how do we balance the autonomy with doing the right thing from the doctor's perspective?
So at the end, right, the patient is not the doctor, right. You're a very able person from journalism, you do your job, I do my job, right. So we should respect the job that the doctor is doing, and they by and large mean well, right. There can be errors. So I think when we talk about, that word autonomy bothers me a little bit. I think patients don't have an autonomy. We are only trying to make the process better. It is terribly one-sided because हमने तो भगवान के हाथ में दे रखा है, अब जैसे ऊपर वाला करे, right? But नहीं, I think ऊपर वाला करेगा, but can I play my role is what we want the patients to do. Now the patient cannot be overbearing,
Correct.
right?
Correct.
That he becomes a pain to the process. There are, right? We all have fastidious customers or difficult employees or high maintenance employees. So we have high maintenance patients also,
Correct.
right? But that's not the majority. Majority are listening, right? They will participate, they will believe in you, and let's believe it that collectively the healthcare industry has not done enough to build trust. So you know, if you look at foreign countries like Britain and many other countries, Singapore, right? Healthcare is free. In India also, before all these hospitals came up, we all went to government hospitals. Correct. And civil surgeon used to be there. And
Yes.
so there was an entitlement of free. Now healthcare is becoming expensive. The equipments are expensive. Earlier, doctor took a judgment with limited information. Now he can be far more precise in the diagnosis because they have tools like MRI and tests and cancer tracers and so on, which help them do a precise, and is going to cost, right? Insurance in India is still very low, yes. So it's an overbearing issue, but those are larger issues that come up. But there is a mistrust that comes in. But it's my body, right? I am taking a risk of not following. you don't want to follow the doctor, it's your thing. I would advise them that, look, it is possible that there are some places that you don't want to trust, don't go there. Not everybody is out in this game like that, and of course there is this issue of whole things on, you know, whether the diagnostic labs pay up, the pharma companies. This is a much larger issue. But let's not get on that track, because we will go off track. That's again a minority in my opinion. Right. So if you have a doubt that what the doctor is prescribing is not good, there are two choices. Ignore it, right? Or you go and take a second opinion, right? You can go and discuss with the family, this is what I've told, can you advise me something? Somebody or the other will give you a second opinion, and then you take your call, right? So I think a good balance is there. We really respect the healthcare industry for what they do. When people used to run overseas for even small surgeries, etc., I think things have changed a lot, but there's a lot of things to go. India, unfortunately, is called disease capital for diabetes. We have the largest incidence. Yes. BP, hypertension, we have the largest incidence, right? And I think if people are little aware and catch them early, we can prevent it. I cannot resist myself by sharing this thing. When I was running a large software company and we had many employees, we always had some programs for them, and I said, well, let's do a eye check, because eye is very important in healthcare. You know, we always had the eye drops available. We would give breaks to people, right? But I said, free healthcare checkup. We got the best company in Bangalore to come and do it, and they would give you a 15% discount if you bought things from them. So can you believe, after the first 1,000 employees that went in, 28 of them under the age of 30 were diagnosed with diabetes through an eye check, right? You see the number of news items you're getting about young people dying with heart disease.
Correct.
Right? Let's not blame COVID for it. You had some issues. So preventive checkups, right, is extremely important for us. So let us do our part as a patient and a caregiver, or a would-be patient, as a person who doesn't want to be a patient, right? We have to work towards it like you do everything else.
Correct.
So it's a body, diseases come unknown. You might be keeping a fittest body, go to gym, do yoga, all that is very good, eat well, but don't ever ignore symptoms.
Absolutely. I think that's a very, very strong message there. Don't ignore the symptoms. My last question to you, sir, is that are there any programs that have been initiated in the hospitals or the environment of caregiving which have seemed to work and have bettered the situation, or have created the environment of patient and the care and the hospital's partnership or engagement together and change things?
Yeah, I think there's a lot of effort going on there. So there are often family groups that are addressed. There are support groups that hospitals encourage to form, cancer support group, diabetes. So there are lots of groups who are now sharing information. They actually recommend you to go there. If you have rare diseases, there is a support group there which, talk to each other and do it. I think many hospitals are now trying to move gradually, because it will take time to mature, towards the patient advisory councils, who would probably initially focus on the hygiene factors, right? Waiting time, billing, discharge, food for the caregiver, sleeping place for caregiver, parking, all these are big issues that need to be, but those are hygiene, important though. And then is a clinical side, right? So I think there is a lot of good work. I think the amount I've seen some good surgeons actually drawing, they get you a model to show what are we going to do, right? Yes. Which is educating. So I think there are attempts going on. We just need to make it more. And when some of the doctors are doing it on their own, with others that don't do it and you want to know, don't hesitate in asking. And you know, if a doctor tells me I have no time for you, I said you have to find time for me for this. I need to understand. If you can't explain me, please ask the nurse to explain to me. Please tell me where to read, right? So I think to me, this is not about them and us. It's about, it's my body, I am the patient. I have only one request to them. Can I get back home safely and disease free? That's my only expectation, right? So fine, if you make my stay there very comfortable, it will be even better, but I need safe health.
Correct. I think it is so important that people understand one fact, and that is that हम बोलते हैं ना कि ask and you shall receive, but you should know when to ask, you should know what to ask. And I think for a patient it is important to understand and know that the system is not doing a favor, neither are you doing a favor. You have a responsibility towards your own body, you have a responsibility towards getting well, and you have the right to get the correct treatment and know about it. So thank you so much, sir, for sharing all the pearls of wisdom. And I think, you know, the work that you are doing, you know, with this patient for patient safety should result in a healthier lifestyle with better outcomes, and creating a faith in the healthcare system, and making doctors also fearlessly trying to help you by devoting time.
And you know, thank you very much. I believe it's an uphill task, but we will be at it. It's we are patient with what we are doing, right? I think gradually we will get there. It is a requirement for us. And I would just like to add at the end, when an emergency comes in life, it's not very often. It comes once in a lifetime. And that time, when you have an emergency, you're not going to Google information. So please equip yourself, be safe, not only for your sake, but for your family, your friend, your colleague. Anyone could need you. That time, right, you should be available to them. Among everything else you read and so on, just pay a little bit of attention on this aspect. And with the help of organizations like yours and the work that you do, we hope our message will go out to many more.
Absolutely.
Thank you so much.
Thank you so much, sir.